This is Andy Shorr from the Washington Hospital Center with your Pulmonary and Critical Care Literature Review update for the month of March. There are two articles I'd like to talk about today. Both deal with specific pulmonary issues that are very important. The first, by Rosala and colleagues in this month's Chest, deals with the prevalence of pulmonary embolism in patients who present to the hospital with what are thought to be acute exacerbations of COPD. COPD is a burdensome illness. Much of the morbidity in the disease is driven by the rate of exacerbations, and the problem with the approach to the patient with a suspected exacerbation is the diagnosis remains clinical. There's no test, there's no blood serum marker, there's nothing but clinical acumen to really make the diagnosis, certainly in the light of changing dyspnea complaints, sputum production, and sputum purulence. Again, though, it remains a very objective diagnosis. Some literature has emerged that patients who have what are thought to be COPD exacerbations actually are suffering from venous thromboembolism and pulmonary embolism specifically. So there have now been several studies that have actually looked at the prevalence of pulmonary embolism in patients who present to the hospital with what are called COPD exacerbations. Now again, the symptoms that they present with are very nonspecific, so it's not clear that we're talking about COPD exacerbations driven by venous thromboembolism, but really a syndrome due to venous thromboembolism that is mimicking the symptoms of an exacerbation. Again, it becomes one of those things, well, if someone's got COPD and they're short of breath, it must be an exacerbation, as opposed to looking outside the box. In this meta-analysis, they looked through over 2,000 studies, found 5 well-done studies that looked at the prevalence of venous thromboembolism in patients who presented with COPD exacerbations, and on average, they found that about 1 in 4 to 1 in 5 patients who had what was thought to be a COPD exacerbation actually had a pulmonary embolism. That is a huge rate, and it suggests that we are missing pulmonary emboli in patients who have what's thought to be a COPD exacerbation. Now, you have to be cautious here in understanding what the studies did. These are looking at populations of patients where someone thought to order the VQ scan. It's not taking everybody in an unselected fashion who showed up to the ED and scanning them. Some studies did do that, but not all studies did. And so it's important to realize that the methodology here, essentially in terms of pretest probability, is important to capture. Again, some of these patients, there's a selection bias because someone went looking for it, as opposed to looking at unselected patients, which was done in other studies. They did find that the prevalence of venous thromboembolism was actually higher in the cohort of patients who were actually hospitalized for their exacerbations versus the patients who were not hospitalized. What they also saw was a wide range. Very low rates of PE in some of these studies, less than 10%, but as high as 20 to 30% in others. Again, in all of these studies, however, the rate was not 0. So again, what I think this suggests is that some patients who do present with the history of COPD and come in with dyspnea have something other than just a COPD exacerbation. So the message, I think, to our ED colleagues, our hospitalist colleagues, and even to ourselves is, just because it looks like a duck and walks like a duck doesn't mean it's only a duck, and we need to have a broader open mind to the differential diagnosis. We ought not go around scanning everybody with a COPD exacerbation for pulmonary embolism, because then we'd be exposing many, many patients to contrast risks that we don't need, and we'd be setting them up for renal insufficiency and potentially dialysis with too many diloads. However, we have to understand that if something's outside the box or there's something that doesn't fit, we really have to think that, that in this patient with COPD, pulmonary embolism might actually be an issue. So you have to keep that in the back of your mind as you approach your patients, and I think this literature is going to evolve over time because it's a very interesting topic. And with that, this is Andy Shorr with your Pulmonary and Critical Care Literature Update for March. Hope everyone's having a good day. Thank you.